Hello everyone, this is Chadi Alraies coming to you from NYEVS. This is a 2025 conference in New York. A lot of buzz, this is a lot of going on. The conference room is busy, the fellows course is going well. I'm really privileged to be with Dr. Vishal Kapur. He's one of the director of the course to talk about what's new and what is kind of update from last year. Dr. Kapur,
thank you for having me. I think NYEVS has been growing in the last 3 years, and we've progressively increased in volume, quantity, as well as the faculty we're having here at our conference, and we're proud to have a wide spectrum of effect on the peripheral arterial disease. We have great faculty all the way from Europe, from Japan, from Singapore. With our goal now is to just bring about more awareness and more education about PAD, especially what we call as critical limb life-threatening ischemia, CLTI or CLI. So we have a complete dedicated 1 day of session purely based on CLTI, where we'll not only show live cases from Mount Sinai and across the world, from Germany, from Leipzig, Germany, from Chris Metzger down in Ohio, but our goal is to impart education, because this is one of those new or one of those disease processes which has affected a lot of people. Initially had limited intervention or limited treatment abilities, but now with advented technology, whether it be the atherectomy part, and now with the new bioabsorbable scaffold being a game changer, I think this is one of the fields where everybody needs to focus on, knowing that the increased mortality can be prevented by identifying and treating these patients on time. So I think that's what we focus on nowadays.
I have an epidemiological question for you. Like every conference we say increase awareness. Like why the patient community and physician not aware of that yet?
The problem, I mean, our goal for my personal goal is like save limbs, save life. The issue is the problem is PAD is multifactorial. It starts all the way from primary prevention, diagnosis of diabetes, blood pressure, cholesterol, smoking, which has to be taken care of from the basic primary care perspective. But unfortunately, the way the medical system is structured, for lack of insurance, lack of awareness, lack of access to PCPs, by the time they really come to the hospital, the ship has already sailed. So that's the unfortunate part. And now we're pretty much trying to catch up and trying to fix the problem, which becomes grave as in how you prolong the misery. So I think the goal eventually of these conferences is to not only educate physicians and future fellows on the technical aspect, but also provide them with enough data to support what needs to be done to help in this disease process.
Absolutely. Now, New York is always hotspot, especially Mount Sinai is a lot of high volume, as you said, and live cases is phenomenal. So I met with the fellows here and really enjoying the course. I mean, what is your vision and why you're invested in the fellow?
Well, so we have a whole full day dedicated fellows course, which happens just before the main conference kicks in. And we have approximately 70 fellows coming from all fields. We have interventional radiology, vascular surgery fellows, interventional cardiology, and even third-year general cardiology fellows who want to pursue interventional cardiology. So our goal is to try to expose them. Nowadays everybody wants to talk about fancy stuff. It's structural, it's valves, it's this, which is great. Listen, that is also a part of our body and we need to fix. But the whole idea is to try to create more awareness among these patients, because like from my perspective, being a cardiologist, we are technically cardiovascular disease specialists. So people forget about the vascular part of the cardio. Everybody's like, quick stethoscope, clean heart, clean lungs, go home. What I tell them is just take 2 minutes or 1 minute, 2 questions and 1 physical exam of the leg, and I think you will do true justice to the patient.
Absolutely.
And that's where our goal is to try to create more awareness about
and the motto you just mentioned earlier, saving limbs, saving lives.
That's the goal.
Yeah. Dr. Kapur, thanks again for putting this conference together and being a great advocate and really a passionate limb salvage physician. Watch the videos and others on YouTube channel. This is Chadi Alraies coming to you from Manhattan, New York. Thank you again.
Perfect. Thank you.